The mad dash to book a shot in the arm is underway here in Ontario's COVID hotspot as Peel has expanded eligibility to everyone, every adult living in the region. And while this is great news, there are questions surrounding just how long supply will keep up with demand.
Not at the point right now where I feel that we have a demand that is not being met. That could change in 2 weeks.
This week, Peel Region is expecting about 151,000 doses as part of the province's plan to send 50% of vaccine supply to the hotspots. A similar shipment is expected next week, but after that, as we heard from the health minister yesterday, allocation will then spread out across the province on a per capita basis, despite a recent report by Ontario's Science Advisory Table suggesting much more is needed.
The 2-week period should be sufficient to bring transmission more under control in these hotspot areas.
Well, that hasn't been confirmed to us.
And while Mayor Patrick Brown was not expecting to hear that from the health minister, he remains optimistic about the ongoing talks with the province.
Yeah, we'll keep a close eye on this, but right now we're still hearing encouraging commitments from the province that they're going to maintain supply at the levels that we can vaccinate.
And Mayor Bonnie Crombie made her case during yesterday's briefing.
2 weeks is not adequate. I think they need to continue to do it for the foreseeable future. It is the fair thing to do, and it is the moral and ethical thing to do.
As of 8 a.m., eligibility here in Peel Region opened up to the 50,000 remaining residents living in the 8 area codes that the province still has not designated as hotspots, along with the other 90% of the region. And demand was high. If you logged on first thing this morning, you were likely greeted with a loading page that likely took you nowhere. Public Health tells me there were some glitches today, and because of that, the phone lines were swamped. Bookings, though, were made easily through Trillium Health Partners. Public Health tells me right now it's booking about 15,000 appointments every day.
Ready on the way. Very good.
And with the region now getting about 100,000 needles in arms every week, infectious disease specialist Dr. Anna Banerjee is hoping the province will continue paying special attention to the hotspots, telling me it's the only way out.
They're driving the epidemics. They're driving the hospital admissions and ICUs. And if we're really trying to be strategic about this, what we need to do is target the groups that are at highest risk. And right now it's Peel and Toronto and a few other places. And so that's how we get this pandemic under control.
Now, we did reach out to Minister Elliott's office asking more questions about the future of supply for hotspots such as Peel Region. At this point, we're still waiting to hear back.